Small business is the lifeblood of the Ohio Valley.
From furniture stores and restaurants to professional services and healthcare, the Ohio Valley has a long tradition of hardworking people.
I'm Laurie Labishak with Trinity Health System.
And I'm Wendy Anderson with the St. Clairsville Area Chamber of Commerce.
Come with us as we explore the people and places that make the heartbeat of the Valley, where the strength of two
Works for you
on Hometown Heartbeat.
Hi, my name is Wendy Anderson. I'm the director of the St. Clairsville Area Chamber of Commerce. And today we're here at Trinity Health System Plaza in St. Clairsville. We're going to meet with Laurie Labishak, who is the marketing director for Trinity. So let's go on in and meet Laurie. Hey Laurie, thanks for having me here today. I am so excited to be here for your first year anniversary. So tell me a little bit about it.
Wendy, we are so excited to be here in Belmont County. As you know, last year when a couple of local hospitals decided to close their doors, Trinity Health System out of Steubenville stepped up, and we wanted to make sure that we bridged the gap so that patients had that continuity of care with their providers. So we immediately looked at how can we make sure patients still connected with their physicians and their nurse practitioners or whoever it was that was providing their care. So these two buildings here, located at 106 and 109 Plaza Drive, right behind Respecs in St. Clairsville, were operated by that local entity. We talked with the landowners and we worked out a lease so that we could continue to operate right where these providers were operating. As a matter of fact, Dr. Maria Setlak is still in the same office that she has been in for years. Wonderful. The patients that come to see her are still seeing her in familiar surroundings, seeing the same nurse practitioner, seeing the same physician. That's so important when it comes to continuity of care. Mm-hmm. So here in this building, which is our 109 Plaza Drive, this has a couple of provider offices, Dr. Carol Greco and Dr. Maria Setlak, as well as physical therapy and occupational therapy. Also, Davison Audiology is located here. Okay. So this is an outpatient center. So we do a variety of physician office visits here, as well as physical therapy and those types of things.
So Laurie, this looks like the physical therapy department. So tell me a little bit more about this.
That's right, Wendy. This is the physical therapy gym. So patients who are recovering from an injury or a hip replacement, knee replacement, they can come here and get their physical therapy that is ordered by their physician. We have several physical therapists that work here in this area. There are a variety of modalities that they can offer here. And right now, here's Mike. Come on in, Mike.
Hello.
Hi.
Doing a quick interview talking about what you do here. So can you tell us a little bit about the services? Tell us who you are, first of all.
My name is Mike Butkus. I'm a physical therapist. I've been working for about 20 years. We do a lot of orthopedic treatments, evaluations, movement dysfunction, pain, chronic pain, acute pain, sports-related injuries, ACL repairs, ankle sprains, just about everything that the doctors refer to us. We pretty much take a look at and see if there's quality of life improvement that we can give to the patients or not.
And Mike, you were part of the other hospital when they
Yeah.
closed. What did it mean to you when Trinity stepped up and said, we're going to keep you here, we're going to keep you seeing your patients right here?
Right. It was amazing to us, the staff. It was amazing to the patients because we have a pretty good following of patients.
Mm-hmm.
Once you've picked a physical therapist or a doctor or specialist or lab or whatever, you kind of feel at home with those people. So it was good service to us, obviously, to have jobs, but for our patients it was amazing because we had, everyone was so disappointed when we were shutting down out here because of the convenience of the services that we provide, from lab, x-ray, physical therapy, physicians now as well. So that's and it's all about the patient care. So if it makes them happy that we stayed, we're obviously more than happy to be employed. That was important, but the patients, like, when you're in patient care, your heart kind of, is broken when you have to leave them. Sure. So it was, we have a good following, and it's kind of like family out here. Everybody that's employed is family, and the patients feel that way as well.
Well, Wendy, this is Tiffany Hartlib, and she is the clinical director here at the St. Clairsville Plaza.
So Tiffany, tell us a little bit about what goes on, what is part of your role here as a clinical director in the St. Clairsville Plaza.
Great. Well, it's a pleasure to meet you, and thank you so much for giving a quick spotlight highlight here on the Trinity Health System. As you know, we've been here just a little over a year,
Yes.
and we're really excited about the progress and the expansion here into the Belmont County area. So for the last 12 months, Trinity Health System has been really privileged and honored to expand their services here to the Belmont County region, specifically in St. Clairsville. And we also have a presence in Bel Air with Kathy Harris's office. So we currently have a variety of primary care providers, and we also have pulmonary services with Dr. Blatt and a really qualified nurse practitioner. What we are hoping to do is to continue to expand in the near future by bringing much needed specialists so that folks don't have to travel outside their immediate area to access really critical health care.
Tiffany, can you share a little bit about how this location in particular has rebounded after the pandemic?
You know, that's a really great question, and I think one thing that we're constantly continuing to evaluate, I think like most primary care providers and other healthcare systems across the United States, one of the things that we really wanted to do was to rebound quickly. I think everyone was kind of scrambling for PPE, and as a part of Common Spirit and Catholic Health Initiatives, we really had access to a lot of things that a lot of systems were really struggling to have. So that type of national alignment really allowed us to be ahead of the curve and be a lot more prepared with managing, and really allowed us to be more proactive with how we were managing potential COVID patients here in our clinics. With that said, as we started to ease some of those restrictions, what we saw was a level of comfort. We were doing a lot of telehealth initially, and we really started to see patients being a lot more comfortable with coming back into the clinic with some of those new protocols that we had put into place just to ensure their safety.
Hey Laurie, this looks like we're in the x-ray room.
You got it, Wendy. Can't pull anything over on you.
No, you can't.
So this is one of the x-ray rooms that is set up here at our St. Clairsville Plaza. And we also have a mammography room, as I mentioned earlier. So we can do pretty much any service here when it comes to radiology. So if you have an order from your physician and you need to have an x-ray or your mammogram, you don't have to drive too far away. You can come right here to the St. Clairsville Plaza.
Nice. This seems like it's very intimate for the people to come here. It's just all inclusive, and I really like the feel of this.
Well, and the other wonderful thing is that we kept the same employees that have been working in this suite for many years. So the patients who have been using this space as their home place for their mammograms or their x-rays, they're still seeing the same staff. They're still interacting with the same professionals. It's that continuity of care from start to finish.
Can you see us?
I can see you.
Can you hear us?
I can hear you.
Okay, there you go.
That is amazing.
So we do something called parking lot visits,
Okay.
where patients don't want to come in the office. We give the iPad. We have Wi-Fi that extends out in the parking lot. We run the iPad out to the parking lot,
Okay.
and we do the interview in the parking lot.
So then you are sitting in your desk.
Yep.
And you have your iPad.
Yep. Well, no, they add my computer.
They have your
So
computer.
Lori is looking at my computer right now.
Oh, okay.
So we have all that patient information. So Lori is looking. Remember HIPAA, Lori. Don't look at the she's on the chart, okay? So what happens is that I'm in there and I can go through all their computer information and all their data and all their medications and all their tests.
Okay.
And I can spend time with them that way, because the Center for Disease Control said it's effective cumulative how much time you spend being exposed. So it's 5 minutes for each patient or 15 minutes for one patient. It's all significant. So we can be a lot safer and see our patients a lot more effectively, and nobody has to worry about infection.
Wendy, thank you so much for coming out to celebrate our 1-year anniversary here at the St. Clairsville Plaza.
Laurie, it's been a pleasure, and I am so glad that you guys are here in St. Clairsville. Be sure to join us next time on Hometown Heartbeat.
Daisies blooming, sundress swaying in the breeze. I can't stop staring. You've put a spell on me, and I hope that you never decide to set me free.
Even in a pandemic, accidents happen. But in times like these, you may be hesitant to go to the ER. So we've taken extra precautions to keep you safe. Because now, more than ever, we're here for you. Trinity Health Emergency Services.